listen-only mode.
Hello and welcome to this presentation of Hypertension Hype. My name is Lori Benison and I'm a wellness coach for Lovelace Health Plan. Before we get started, I'd like to go over a few housekeeping rules. If you have any questions, you can email us at healthysteps@lovelace.com. You are in listen-only mode. If you experience a delay in the slides or scratchiness, static on the line, it's usually due to weather problems that resolve themselves relatively quickly. If you do get disconnected, don't panic, just simply call back in. This presentation will last approximately 15 minutes. Your feedback is really important to us, so please take a moment to complete the evaluation that you'll receive via email at the end of the presentation. And just so you know, this webinar will be recorded and it'll be available for future reference at www.lovelacehealthplan.com at our Healthy Steps site. So hypertension is also known as high blood pressure, and it's often called the silent killer because it's a deadly disease that shows no early symptoms, yet it's the single most significant risk factor for heart disease, congestive heart failure, stroke, and kidney disease. In this presentation, we're going to discuss the causes and effects of this disease, the risk factors and symptoms, and then some simple lifestyle habits to manage the risk and prevent and treat hypertension. So what is blood pressure? So blood pressure is the outward force of blood on the walls of your arteries. And blood pressure is measured in millimeters of mercury, and it's expressed in two numbers. For example, 117/64 millimeters of mercury. So the top number, or the first number, is called the systolic blood pressure, and it represents the pressure in the arteries when the heart beats and squeezes and empties. The bottom number, or the second number, is called the diastolic blood pressure, and it represents the pressure in the arteries when the heart relaxes and fills with blood. So everyone's blood pressure goes up and down, but when it goes up and stays up, that can be a problem. A normal blood pressure reading is considered to be less than 120/80. And hypertension, or high blood pressure, is diagnosed at 140/90. So if you get a blood pressure reading that's above 120/80, it's recommended that you just check it periodically. And if it's consistently above 120/80, then you'd want to have a conversation with your doctor. You can have your blood pressure checked at home if you own a blood pressure kit. And if you don't, you can get it checked at the grocery store, the drugstore, or even your primary care physician's office. So high blood pressure is pretty prevalent in the United States. 1 in 3 adults over 20 have high blood pressure, but 22% don't even know it. In 90 to 95% of the cases, the cause is unknown. So there's two types of risk factors, primary and secondary. Primary hypertension has risk factors often related to everyday lifestyle choices, things like a lack of exercise or an overconsumption of fatty foods, restaurant foods, processed foods, overconsumption of alcohol, stress. And then in secondary hypertension, there are underlying causes like problems with the kidneys, heart, or adrenal glands. So while there are often no symptoms associated with high blood pressure, the damaging effects are serious and can include vascular weakness or scarring. Also increased plaque or cholesterol buildup in the arteries, increased risk of blood clots, which in turn can increase your risk for heart attack and stroke, increased workload on the circulatory system, so it just puts a greater strain on your system, and then tissue and organ damage from the narrow blocked arteries. Often we see this in the kidneys and the eyes as well as the heart. So complications. Some of the complications for hypertension include cardiovascular disease, where the arteries of the heart harden. Also kidney disease, where the blood vessels in the kidneys harden and narrow. Peripheral artery disease causes arteries throughout the body to harden and lose compliance. Heart attack, heart failure, stroke. Loss in cognitive abilities like reduced memory, problem-solving ability, concentration and judgment, vision loss from swelling of the optic nerve, and then also erectile dysfunction that can result from decreased blood flow due to the narrowed arteries. So some risk factors can't be helped, like family history, advanced age, and gender, while others can. The risk factors that can be modified are lifestyle choices that we make each day. Things like how much exercise we get, our intake of fruits and vegetables, how much salt we consume, whether or not we're overweight, and excess consumption of alcohol. I've often heard it said that it's genetics that loads the gun and lifestyle that pulls the trigger. So we've already said that one of the things that makes blood pressure so dangerous is that there's often not any symptoms. It doesn't hurt, so it's easy to ignore. However, if blood pressure is dangerously high, a person might experience things like severe headache, severe anxiety, shortness of breath, or nosebleeds. So prevention and treatment. Notice again that most of these risk factors are preventable. Most of the prevention practices also work for treatment. It sounds simple, but the bottom line is to eat right and exercise and maintain a healthy weight. We recommend that you get 30 to 60 minutes of moderate to vigorous physical activity daily, and favor a diet high in fruits and vegetables and low in saturated fat, trans fats, and sodium, and also consume alcohol in moderation. It's said that the first prescription written by Hippocrates, the father of modern medicine, was exercise. And it's a good suggestion for managing blood pressure as well. Indeed, a brisk walk every day, 30 to 60 minutes, can lower blood pressure 10 points. To see the most dramatic effects in lowering blood pressure, include some resistance training like weightlifting and calisthenics. Hippocrates also said, "Let food be your medicine." To help manage hypertension and to enjoy good health in general, control portion sizes and favor fresh fruits and veggies, whole grains, low-fat dairy, and lean meats. Consume healthy fats and oils like those found in fish, nuts, and avocados, and limit your intake of sodium to no more than 2,400 milligrams a day. So sometimes, even with regular, consistent exercise program and careful diet, blood pressure will still remain high. In this case, you may consider medication. Many blood pressure medications work by helping the blood vessels relax to allow blood to move more freely, or by causing your kidneys to produce more urine to excrete excess sodium or salt. So let's talk about some myth or facts. It takes months to reduce blood pressure after starting an exercise routine. You think that's true or false? In fact, that's false. It is a myth. Exercise acts quickly to improve blood pressure among people with hypertension, with most of the effects taking place within the first few weeks. So, as we said before, walking is great exercise, so grab those tennis shoes and get moving. Okay, here's another one. Myth or fact? People with high blood pressure should not engage in resistance exercise because blood pressure will increase further. That also is a myth. Research shows that individuals who participate in moderate intensity resistance training can lower their systolic blood pressure by 2% and their diastolic blood pressure by 4%. So head to the gym and lift some weights, or buy yourself some dumbbells for your home. Make sure that you target all of your major muscle groups. So that concludes our presentation on hypertension, HYPE. The bottom line is, basically just eat right, exercise, and maintain a healthy weight. It seems to be the answer to a lot of disease states because it's really simple and it works. If you have any questions or comments, please direct them to healthysteps@lovelace.com. You'll be receiving a survey at the end of this presentation, so please take the time to complete it as we use this information to help us improve our process. Our next webinar will be on Wednesday, September the 26th at noon, and the topic is going to be work-life balance. To register for this webinar, visit the Wellness Center at lovelacehealthplan.com. Thanks again for attending. Until next time.